Hi everyone, I'm Dr. Blessy, Clinical Head and Senior Fertility Consultant at Premom. Today I'm here to talk to you about a pediatric and adolescent health concern that is called early puberty. Medically, it is known as precocious puberty. This video is for educational awareness based on medical understanding and recently published research to make parents understand why this condition is discussed worldwide, including in India. Over the past 2 decades, large population studies in multiple countries have shown a trend of early onset of puberty in girls. Research published in international medical journals have confirmed that the average onset of puberty in girls have been declining. Clinically, we define precocious puberty as the first onset of breast development before the age of 8. However, in our practice, we are seeing girls entering into these puberty signs in between the age of 8 to 10 and their first onset of menstruation, that is menarche, in between 11 to 12, which is gradually earlier than the before generations. Indian hospital-based studies, pediatric endocrine reports are clearly showing that there is an increase in early puberty in girls and more frequently in urban settings. Factors such as changes in nutrition, rising childhood obesity, more screen time, less physical activity, environmental influences are contributing to this shift. This is a concern because early activation of the hormones can affect the child's health. In this video, I'll explain you what is early puberty, why is this happening, what are the hormone changes that are involved, warning signs for parents, when to seek medical help, and how tools like Premom can help track the development safety. What is precocious puberty? Puberty that starts before the age of 8 in girls is considered as early puberty. The signs includes breast development, growth of pubic and underarm hair, rapid height growth, and onset of first menstruation before the age of 11. Why is this a concern? In this condition, we see early activation of hormones way before time. This leads to short adult final health, emotional stress, low self-esteem, early sexual maturity without emotional readiness. We see higher risk of conditions like PCOS and other metabolic conditions, higher risk to menstrual disorders, and increased long-term risk to breast and reproductive hormone-related diseases. Causes of precocious puberty. There are 2 causes that contribute the precocious puberty. One are the biological factors, other are the lifestyle and environmental factors. Biological factors include the activation of the hypothalamic pituitarian ovarian axis, brain rare conditions which involve tumors and lesions, genetic tendency in some families. Lifestyle and environmental factors, childhood obesity, intake of highly processed foods, increased screen time, low physical activity, sleep disruption, stress, and exposure to endocrine, that is the hormone disrupting chemicals that are present in cosmetics, plastics, and also in perfumes. Early signs parents can detect: breast budding, rapid height gain, pubic and underarm hair growth, acne, mood swings, vaginal discharge, or any menstrual bleeding. Can it be preventable? It might not fully be preventable, but we can maintain the risks that comes with this. We need to maintain a healthy body weight, avoid having junk food and processed food, start having nutritious food, increase the physical activity either by exercise or any outdoor sport, avoid exposure to endocrine disrupting hormones in plastics and any other cosmetics and perfumes, avoid taking unnecessary hormone supplementations. Menstrual problems seen in girls in early puberty. There are different kinds of menstrual disorders that girls experience if they get early menstruation before the age of 10. Some see irregular cycles, some have very short cycles less than 21 days. There will be long cycles around 2 to 3 months. Some experience bleeding days more than 7 days. Some have spotting between the cycles, and some experience severe cramps, fatigue, and anemia. Girls who get early puberty might see other complications later in life. These includes PCOS, insulin resistance, other metabolic disorders, thyroid problems. They might also experience mood and anxiety issues, stress related problems, and low self-confidence. How Premom can help girls who get their early puberty. Premom is positioned as a menstrual health and symptom tracker, especially for adolescents who get their menstruation way too early. It is not about fertility tracking in children, but it helps parents and doctor understand the child's hormonal patterns safely and deeply. What parents can track using the Premom app? The app can be used to track period dates, the start of bleeding days and end of bleeding days, cycle length, the number of days between the periods, flow patterns like scanty, heavy and moderate or spotting between the cycles, symptoms like abdominal cramps, headaches, fatigue, mood swings or any other associated symptoms, missed periods or frequent periods or irregular cycles. Why this tracking is medically helpful? It helps us understand is there any abnormal bleeding patterns. It also lets us know if there is any cycle length differences, either short or too long, which is associated with the hormonal imbalances. It helps the doctor understand is the puberty progressing normally or rapidly. If you go to a medical consultation, it gives you a clear and accurate history. Lastly, it helps us monitor the cycle is improving with the help of any lifestyle and medication.